Hi class, my name is Sandra Tapia and this is my HTTP presentation, Telemedicine in Today's Healthcare. So the objectives for this presentation are to examine consumers' preference to receive telemedicine, explain how telemedicine can overcome distance barriers, discuss how telemedicine can be cost-effective, discover the use of telemedicine in correctional facilities, identify how telemedicine expands into other nations, and compare traditional office visits to virtual visits. Healthcare has evolved in many ways and forms and continues to evolve each day as technology advances. Telemedicine involves the distribution of health-related services and information via electronic information and telecommunication technologies. It allows long-distance patient-clinician contact, care, advice, reminders, education, intervention, and monitoring. Telemedicine can help combat many challenges seen in today's healthcare, such as work shortages in both primary and specialty areas. This form of healthcare can be used when patients are faced with distance barriers to help improve access to both acute and chronic conditions. The world of healthcare is ever growing and drastically changing day by day as technology enters our homes and our communities. Telemedicine is used to provide a variety of healthcare options to many different populations. The theorist selected for this paper was Virginia Henderson. Virginia Henderson developed a nursing theory that applies to all patients as a whole. According to Henderson, before health components can be addressed, people's basic needs must first be addressed. So her theory emphasizes on the importance of increasing the patient's independence so that progress after hospitalization would not be delayed. Her components, the components in her theory are categorized in 14 sections that are listed here, the 14 basic human needs. And then there are four major concepts that are included in the theory, which include the individual, the environment, healing, and nursing. Her theory applies to this paper because as a nurse, we assist patients in the hospital to help them to feel better and help them to help themselves to gain independence so that they can take care of themselves after they leave the hospital. So with the use of telemedicine, the patient must be able to be independent and feel comfortable enough to use these types of services for their continuation of care. So telemedicine can be delivered through many different forms. Physicians who have established relationships with their patients in the past and had those face-to-face appointments, they can transition those into telemedicine video communication consultations if the patient feels comfortable doing that. Another form is using the same telemedicine in a primary care setting. And even though that patient has never had a certain physician before, it's still in the same office, and that physician still has access to medical records for that patient, so people can feel safe doing that as well. And then there's a complete opposite route where people have never met certain physicians, and they're getting video consultations with them for the first time. So it just depends on the person and their comfort level with using telemedicine and not being able to be face-to-face with another human being. A program in New Mexico known as the Extension for Community Health Outcomes Program, initially promoted in 2003, it was actually one of the first early examples of telemedicine that was being used to bridge the gap for rural areas to have access to health care. And that initial program has allowed for telemedicine and telehealth to expand tremendously in the Midwest and broaden access to many people to deliver them treatment that way. So it's always important to evaluate a patient's needs and their accessibility and determine whether or not people or patients are candidates or if they can qualify for these types of healthcare deliveries. So that's always important to address. So telemedicine preferences. A study was conducted by Welch 2017 that was intended to understand patients' and consumers' preferences towards direct-to-consumer telemedicine. So seeing what their interest was, their willingness and comfortability to use technology with telemedicine or with medicine to consult with physicians. A survey was conducted using 4,345 people. These people were selected through a SurveyMonkey that allowed for equal nationwide representation of the U.S. population, and it categorized these people into their gender, race, and education. The survey data was analyzed using R 3.11 and SAS 9.4. And the results showed that people were very interested in using telemedicine and felt comfortable using it. And their willingness to use it was also very positive. Limitations in the study included those people that didn't have necessarily access to the internet and people of other maybe languages. So something for the future is that they can mail these surveys out instead of just having them online for people to fill out in case they don't have internet access or those language barriers do come up. Distance barriers. So healthcare can be delayed if people do not have the transportation or if the facilities that they need to get get healthcare coverage are far away from them, within their reach. Healthcare can definitely be delayed due to those circumstances. So Banbury 2018 performed a study to determine what the feasibility, acceptability, and effectiveness of them initiating video conferences in those homes and the people that were willing to participate. And they used a mixed method appraisal tool to collect their data. 1,634 records were identified, and 16 of them were included in this review. So the results show that home-based video conferencing was very feasible, and those was even very user-friendly for those that were had little or knew little use of technology. So that's positive. Limitations could be that they could have a larger sample for the future, and recommendations for future study would be to include higher number of participants so that they can be able to obtain a solid evidence-based information from these studies. So healthcare prices can skyrocket very quickly. Telehealth has been proven to decrease cost of patient care. Ho 2014 conducted a study through the University Hospital in Taiwan that consisted of patients who were 20 years old and older and received care through telehealth programs. And the hospital collected they used an electrical database to collect demographic, hospitalization, and payment data. And they used Chi-square test to compare categorical data. The cost effectiveness was measured by cost case, cost control, effective case, effective control. And with the principle revealing that telehealth programs were associated with lower cost. Limitations of the study include not randomizing the controlled study, and secondly, medical costs and interventions weren't reported. Not all of them were reported in the study. So for the future, they can include all those costs. Telemedicine is not limited to any particular group or groups of people. In fact, it has been used as motivational enhancement therapy. Stats and Tyndall 2014 conducted a study on the use of telemedicine among incarcerated men in a rural Kentucky correctional facility to see if that would reduce the use of alcohol among those at risk. The study consisted of 127 rural alcohol users who were incarcerated in the Kentucky jail. This assessment consisted of a 20-minute screening session, which included the Global Assessment Individual Needs Cognitive Impairment Scale and 3 short mental health questions. Univariate and descriptive analysis were used to analyze data, and the results of this study showed that those incarcerated and received 3 to 5 sessions of telemedicine were associated with a decreased likelihood to relapse into drinking. Limitations to the study include a small follow-up sample. So a future recommendation study would be to include other correctional facilities in other states just to have more variety in their results. Telemedicine International. Telemedicine is not just used here nationally, but it's also used internationally to reach other nations and including third world countries. Brooks 2017 conducted a study to assess how easy it would be to install healthcare or telehealth networks between deprived cities in third world countries and the Medical University of South Carolina. The goal of the study was to make it easy for pediatric underserved populations in Honduras to have access to health education and primary and specialty care. Web cameras were used with video conferencing software installed at both locations, and satisfaction surveys translated in Spanish were used to assess connection quality and technical difficulties using a 5-point Likert scale. Descriptive analysis was performed, and the results were a total of 3 consults were conducted between 2 locations with at least 3 to 6 providers completing the survey with 100% positive feedback. Limitations of the study were to the limited number of the facilities that were used, and recommendations for the future would be to include more clinics so that physicians can connect in a larger group so that there can be more input and ideas. Emergency rooms are always faced with understaffing and high nurse-to-patient ratios. So McHugh 2018 conducted a study to evaluate the progress of the first emergency care telemedicine program in the New York metropolitan area to see if the ultimate goal could be met: decreased wait times and an increased satisfaction scores. So patients that went to the emergency department with minor injuries and complaints were offered virtual visits. These visits were with board-certified emergency care physicians who were located in the area. McHugh collected data from patients after these virtual visits through patient satisfaction surveys, which revealed that in these sections, overall score, doctor courtesy, doctor took time to listen, doctor's concerns for comfort, all resulted in the 90th percentile. So people describe their experiences as amazing and awesome, and adding things like, I felt like the doctor was right there. So they got a pretty good positive feedback from this new service that was being offered. Limitations to this study could be for them to also increase their population, maybe provide these services in other New York hospitals and other metropolitan cities and states so that there can be a larger comparison nationwide. So after reviewing the several scholarly articles presented in this paper, the studies that were conducted throughout the paper revealed positive feelings toward telemedicine and the use of telemedicine. Telemedicine can bring positivity to many different people across the world, whether it's here nationally or internationally. And telemedicine can be used to provide patients with education between the physician and the patient, and it will just continue to grow and grow into the homes of patients. So with that in mind, telehealthcare personnel will need to adapt to the ever-changing healthcare system that is rapidly growing to provide quality patient care. In conclusion, there are many forms to deliver healthcare. Telemedicine has been proven to be preferred by patients over face-to-face meetings. The feasibility and accessibility have allowed patients to take advantage of this form of healthcare system. And through the use of telemedicine, patients can receive their care at a much lower cost. This system will just continue to expand and grow internationally, and the hope is that those that may not be able to have access to healthcare can one day have access through this video conferencing system. Emergency departments as well will just continue to expand and provide patient care, and those who are less acute will be able to experience much faster service and have higher satisfaction rates in those hospitals. So telemedicine works and has been proven to be taken advantage of by many.